Hello, I'm Candy Pettry. Thanks for joining this presentation. I'm going to talk to you today about navigating the journey of driver safety. Kind of the prelude to this was, should dad still be driving? What do you do about it? And Kentucky doesn't really have an age to stop driving. Terry introduced that concept in the information prior to this, but there is actually a time that it's no longer safe to drive. Wanted to provide you all with my information. That way you can get in touch with me if you've got some specific questions. It's a very complex topic, so feel free to reach out to me by way of email. I've included that information as well as my office phone number. I am a nurse by background. I also am a certified professional patient navigator. I was actually hired at UK as their first navigator back in 2013. And I was the first elder care navigator hired in the state of Kentucky. I am a dementia specialist, do dementia training, and I serve as the district coordinator for AARP for Driver Safety. So today we're going to kind of go through the roadmap of what we'll talk about. We're going to talk about numbers, about what's changing, safety practices, different driving strategies, and then just concerns. What are the risks that go with driving safety? There is actually a formal program called We Need to Talk. I'll mention that briefly. And then about, considering driving alternative. So when you talk about the numbers, last year, 778 people lost their lives on Kentucky's highways. That was an increase from the year before, and there were a lot less vehicles on the road. When you think we were in a pandemic, how many people were working remotely? But the thing was, the speed increased. And so 2020 was actually the worst year for the number of deaths since 2017. Fatal crash rates. Again, as we think about the senior population, the rate begins to increase after age 70. You can see on this graph, age 85 and up have the actually highest fatality rate per mile driven. The thing about that, 90% of crashes are preventable, 90%. 30% of fatal crashes involving drivers 65 and up actually occur at intersections. One of the most dangerous things that are out there is one of our challenges. As you get older, that number increases, and it's about 40% for the population that's 85 and up. Numbers are actually people. Statistics really valuable to us because they help us identify concerns that are out there, areas of highway safety, improvements that need to be made in the roadways. But it's really not just about the numbers. You know, each of those numbers belongs to somebody. And that's somebody's mom or dad, some relative of yours, a family friend, and those are people that are no longer with us. So that's 778 people. That's what you need to think about. They are people. So we're going to talk about what's changing. Person's body abilities are changing, vehicles are changing, roads are changing, laws are changing. One of the things I do as a district coordinator for driver safety, I actually teach a driving class to people that are 55 years of age and older. And it's a classroom-led class. We are not having our next class until September, just due to the restrictions of COVID. But I would encourage, if you are of age or someone you know, to look into that. We talk about things such as the changes that are going on. Make sort of an awareness. And in Kentucky, the insurance is mandated to give a discount for a classroom-led driver safety class. And so that's another incentive. Changes in a person's body and abilities. So it could be a medical condition, it could be visual, it could be a hearing deficit, flexibility, strength, coordination. The other thing is, it's harder for someone that's older to recover from injuries. We don't bend and bruise like we did before. We kind of break as we get older, and it's a more severe reaction when you're involved in an accident. There's other changes that go on, medications, medical conditions, impact of alcohol, your brain health, all lead into that. When you talk about medications are designed to help assist with something that's going on with you personally, but they don't come without side effects. So know what those are and know how that's going to work in your body, how a particular medicine is. And when I talk about medicines, I'm talking about prescription medicines, but also things like over-the-counter medicines, herbal medicines, and they can all interact with each other. Some tips to think about. Some of these seem like common sense. You say never take another's meds. Well, again, my role at the University of Kentucky Hospital, I visited patients, rounded on them in our emergency department, which is very large there at UK. And as I'm in a patient's room, and as you all have been in medical offices or surgery centers, hospitals, they will come in to take your history and they'll be saying, now, what medicines are you on? And you're telling them the name of the medicine. And what do you take that for? It is not uncommon conversation for me to hear patient going down through their medicines. And it's like, I'm on this. I use it for my stomach. I'm on this. Honey, what's that medicine I take for my blood pressure? And, the spouse will say, well, I don't know. I don't know. Then yes, you do. Remember, it's yours. You were off of it. You weren't taking it anymore. And I started taking yours a few months ago. Again, don't let that happen. The problem is a lot of seniors are on fixed incomes. They're no longer increasing their income. They're living off of wages, planned retirement funds. So if they can make a savings, it kind of makes sense in their minds. Sometimes, hate to see this medicine, it's so expensive, go to waste. They even will take different name medicines. And if one's 25 milligrams and they need 50, they'll take 2 of it, which is a different medicine than they were even prescribed. So it happens out there. So if you are the caregiver or the friend or family member, just kind of keep an eye on those kinds of things. Make sure the prescription bottles have the person's name on them they're intended for. Take medicines at, at the dose and the time prescribed. Store it the way you're supposed to. Common medicine for older people, thyroid medication. That's something you want to take early in the morning. You want to take it on an empty stomach. You don't want to take most vitamins until at least 4 hours afterwards. Can be sensitive to light, to humidity. So to find someone's thyroid medicine sitting on the side of the sink on the counter right under the, right near the light coming in from the kitchen window, not a good place for storage. It will decrease the effectiveness of that medication. If you start a new medicine, make sure how that's going to work for you. Never take medicines past expiration dates. Again, over-the-counter medicines, probably more likely than anything else. Spring cleaning time, everybody get in their cabinets or wherever you store your medicines, look at them. What's the expiration date? Sometimes they're hard to find. This includes things like sunscreen. Usually about May, we start to see reactions on people from things like sunscreen. Come to find out it may be, oh yeah, I see that. Do they get home? I'll be talking to them. Well, it actually expired in 2010. I didn't know that because I just go out every once in a while. So spring clean, check on your medicines. Carry a list of medicines. Again, I think we all do better at that. If we're going to the doctor, we've got some event planned, we're going to have surgery, but keep that current all the time. Medical conditions that may affect driving. I've listed a lot of things. Again, if you have one of these conditions, doesn't mean stop driving. Oh my goodness, arthritis is on there. Doesn't mean if you get arthritis that you stop driving, but know what limitations some of these medical conditions would cause for you. Diabetes. Somebody whose blood sugar goes up or goes down, one of the symptoms, blurred vision. That's not somebody you want behind the wheel if they're starting to drop their sugar. They also may be fatigued, get lightheaded. So again, just understanding if you have one of these medical conditions, what that means for you. Don't make a poor decision by drinking and driving. Alcohol. Alcohol's effect begins with the first drink. Again, when you think of the senior population, a lot of folks have worked all their lives. They've had families. Their days have been full. They're finally at the point that they can retire. So excited about that. Going to have a couple glasses of wine with dinner. And suddenly it's like, whoa, feeling the effects of that. We see increase with falls. And part of the reason is your body ages, the ability to break down alcohol decreases. Alcohol needs no digestion time. It reaches the brain very quickly. It affects your vision. It affects your judgment. It affects your coordination. So again, just to be aware of that. BAC, blood alcohol concentration, just a little fact in Kentucky, 0.08 is the legal limit. At 0.08, you're about 10 times more likely to be involved in some kind of accident. Vision, another thing to talk about, see changes with. And vision's key in all things you do with driving. There's listed there some things such as cataracts, glaucoma, macular degeneration, and how those particular diseases affect. But as you grow older, see things like contrast sensitivity decreases, depth perception decreases. For all of you young folks that are with us today, I always enjoy giving this information out. It takes 20 times more light to see at night at age, excuse me, at age 40 than it did at age 20. So as you get older, you can see how that's impactful. So driving dawn and dusk are an issue and will continue to be a problem for people as they grow older. This is an example of a self-assessment. Again, some of those classes that are available out there, there are tools like this that are offered up. There are things that you can do on your own and kind of gives you an idea. This particular one's of 10 questions. If you answer yes to one of them, doesn't mean you need to give up driving. If you answer yes to several, it does mean you probably should talk to someone, whether that's your primary care provider, in this case, whether it's somebody maybe to do an eye exam. You know, question like number 8, do you ask yourself, where'd that car come from? You know, have you ever said that? So again, just to kind of be aware of tools that are available. Vision tips, get your eyes examined regularly. Talk about things when you're at that appointment. You know, ask, should I get separate glasses? Some for daytime driving, some for nighttime driving. What about coatings to kind of help reduce the glare? You want to make sure with your glasses that the side pieces, the temples, that they're not obstructing your vision. Some of them are very wide. They can be very decorative and all glammed out, but they also can obstruct vision. Reduce your driving at night, dusk, dawn. You know, use caution. Contrast sensitivity is affected where you can't see the outline of things as well. So fog would present even greater problem. Changes in laws. A couple of things I wanted to mention. Currently in Kentucky, House Bill 439, I think it sits on the governor's desk right now. Currently, there is no repeat vision testing. You have vision testing when you apply for your license, and then that was it. There have been a lot of pushback about when you get a license, do you need to go through vision testing? Do you need to stop at a certain age and have requirements? And so one of the things that has been in the work for years and did finally pass this legislative session is this House Bill 439. It is going to require vision testing for license renewal, and that's if in fact it continues on and isn't pulled back out at a later date with an effective date of July of 2024. The other contact information, drive.ky.gov, and a phone number. That's if you've got questions about how to renew your license now, where do you go? We've got regional centers, the real ID versus standard license, and that 502 is not just Fayette County, but it's also Versailles. Frankfort kind of takes in that whole area. Hearing, something else I wanted to briefly touch on. You know, it's essential when you're driving because it kind of alerts you to hazards that are around, hear emergency vehicles approaching. Your hearing likely decreases as you get older. The statistics say 1 in 3 people age 65 and up have significant hearing loss. Self-assessment for hearing. This is similar to the vision. It's 10 questions. Again, something for a person to do on their own. If you answer yes to one question, doesn't mean, oh dear, can't drive. If you answer yes to several questions, then maybe seek some guidance on what to do. Phones, if you hold a phone up to your ear and you're finding you have to switch it to the other ear because you can't hear real well, that's sometimes a reason. If you're saying to somebody, I'm sorry, what'd you say? What'd you say? In my situation, my television has a number associated with the audio on it. Used to be 12, then it kind of got to 14 was a good number I could hear, and then it's kind of gone to 16. And obviously my TV's getting older, but I don't really think that's what the problem is. Hearing tips. If you're in a car and you're driving, kind of minimize the distractions in there. Turn down the radio. It's okay to ask your passengers, can we just kind of be quiet until we get where we're going? I'm not familiar with this area. Again, because you may not be able to hear approaching emergency vehicles, there are devices such as a wide rear view mirror that you may want to see about having installed. Brain health, important when you're driving. You need to have proper attention, reaction time, be able to concentrate, multitask. Memory comes into play and your problem solving skills. When you talk about that, certainly you think about dementia. It's like, oh my gosh, I'm forgetting things. The thing about dementia, it's generally a progressive disease, and it may come on gradually, especially if you're talking about Alzheimer's. The diagnosis of Alzheimer's does not mean you need to quit driving immediately. It's where you are in that process and how that disease is actually affecting you. But certainly that is something that will happen as the disease progresses, and you should be thinking about alternative transportation options. Think about Alzheimer's, again, mostly think about the dementia, you think mostly about Alzheimer's, but there are other dementias, that are in that umbrella. So this kind of just goes into that a little bit. What can you do about it? And that's a whole nother topic, but some little things that you can do even today is exercise your brain. When you exercise the prefrontal cortex of your brain, then that helps to sharpen your mind. And you do that by mastering new challenges. So if you've got the computer mouse today and you're right hand dominant, use your left hand to work that. Brush your teeth with your non-dominant hand. Getting warmer here. If it's a nice day, sit outside and eat with your left hand. If you're outside, you can just kind of hose down the patio as you get stuff all over everywhere because your finesse is not quite what it would be. But again, that does make different part of your brain work differently and will help to keep your mind kind of sharp. Flexibility, strength. Again, you need all parts of your body when you're driving. And these are some examples of that, why that's important. One of the things you see offered for seniors are classes that work to promote balance. Things like silver sneakers is an example of that. Right now, many of those are online. Many senior centers are looking with opening dates for later in the fall and making adaptation at their facilities as to how they can get back to in-person classes. Changes, another area of changes in your vehicle themselves. They've really changed a lot in the last few years. What used to be kind of modern way out there ideas are really standard. The inside of a car sometimes looks like a cockpit anymore. And there's all kinds of fancy equipment on there. Again, those are just tools. They're not meant to replace driving. They're not meant to be instead of. They're to assist you in being able to drive safer. Smart headlights, voice activated systems. I remember when you had that great big map that you unfolded and unfolded and unfolded again, or an atlas when you were going on a vacation, then you finally got like triptych. And that was kind of exciting. Now you've got these navigation systems that speak to you, upcoming 0.8 of a mile. The thing about that, know your system. Don't rely on it. You can end up in places that are incorrect. Some systems need to be updated. So it is not instead of, it is a tool to use. Changing road designs. This kind of goes through some first that are out there. Talks about even things like roundabouts. Here in Lexington, we have this double diamond, some new changes in road designs for this area, and as now you're starting to see those elsewhere in the United States. Those are proven safety measures. So when new things happen and people aren't used to them, you don't really believe that. When the first roundabout happened in Lexington, we had an increase in accidents because people didn't know how to drive in them. And so, you know, the accidents weren't severe, but there were fender benders that were happening just because of the safety road design. So a lot of studies, a lot of information that goes into that. This is kind of the Bible of some of those designs. I was in a call yesterday where they were talking about the new release date for this. Gets input from the traffic departments, transportation departments all across the United States, engineering input, and I think the new comments and updates have to be in by May, I believe is what I recall from that. And then this new manual will be published so that there is uniformity as you go across the United States. Things like bike boxes, which are green boxes where bicycles are, is something that's going to be addressed in this manual. I mean, there's just roads change, designs change, and so this is kind of to help keep some standardization. I want to talk next about some safety practices. Again, age in itself, not a reason to stop driving, but it does mean you need to take extra precautions because of all the changes that go on. In Kentucky, we've got Be Safe Kentucky. Part of that is buckle up, phone down. I mean, that kind of says it all. Buckle up and phone down. You want to make sure your vehicle's ready. Again, for those of you that have been driving for a while, we had these things called service stations, and you pulled in and someone came out, you raised the hood, they would check your oil, somebody else was washing your window. You know, we're that person, we're that service station attendant now. So you need to make sure that your vehicle is ready to go. Check the lights, check the fluid levels, walk around it, 360-degree inspection, check your tires, proper fluid levels. And that inspection also extends to the environment as well. What's the weather going to be? What are the roads like? Is there black ice out there? Also think about the inside of your car. At 55 miles per hour, 2 paint cans hit with the impact of a piano. That's part of the Secure Your Load promotion from the Kentucky Office of Highway Safety. I can tell you in my role, since I've been at UK, I've seen 2 people, seniors, that had damages occurred by umbrellas that were in their back window of their vehicle. So like the big old golf umbrellas with that metal point on them. One person, gentleman, lost his eye with a motor vehicle crash, and that umbrella coming forward. The other was also received some very severe damage. So secure interior items. Handicap parking, make sure you've got a proper placard. Lexington has done some changes. They've raised the handicap parking fine from $15, it's now up to $250. And they do now have better signage, especially for van parking. Handicap placards can still be updated and renewed through the clerk's office in your individual county. Other safety features, head restraints, child safety seats. Children, and I know we were talking about dad and what do you do, but often it's the seniors that are picking up the grandkids or the great grandkids. So here's the laws in our state. Children younger than 13 need to be in the back seat. Infants need to be in a rear facing child safety seat, and don't put them in front of an airbag. There's also a booster law. A child under the age of 8 years old who's between 40 inches and 57 inches need to be in a booster seat. Now, if they're older than 8 years or they're over 57 inches tall by law. They don't have to be. One other thing I like to mention, I apologize, this slide's a little dark, is the CHAD information. Children have an identity is what that stands for. So if you know someone who has an infant that they pick up routinely and they use that same seat and it remains in the back of the car, label that seat. This is an example of something you can use. Put the child's name on there, contact information, a physician. If a child has an allergy, put it on there. It was named after Chad, whose babysitter was actually killed in an accident. But people come into the emergency room, they may be the driver of the car not able to speak, and the child's fine, and they're bringing them in actually in that infant carrier. But it's great for that emergency team to have information about that child. Airbag tips. Make sure your seat is where it needs to be. Steering wheel hand position. In this slide, you can see that person's hands kind of at 9 and 3. I learned to drive, it was 10 and 2. Some people will say even drop it down to 8 and 4. And the reason for that is because of the airbags. So if you're involved in an accident and that airbag goes off and you've got it up at 10 and 2, then your hands are more likely to fly back up in your face. And if you've got a big watch on, then you're going to end up with broken glasses or a fracture around your eye, some things like that. So again, steering wheel position. And those are things that are changed from the time when some of us learned to drive. So again, classes, education, as the changes that have happened, having someone attend where information like that is shared can be very valuable. Roadway design, rumble strip. I don't know how many of you all have hit that. I have on occasion. You'll be going down the road and it's a boom, you know, and it kind of makes you anxious. Make sure you don't overcorrect. Again, these are safety features, but be aware what can happen, and you haven't blown a tire, you don't have a flat and just come back into the middle of your lane of traffic. Speed bumps, be aware, look for approaching signs. There's speed bumps, there's speed humps, there's now speed tables that they're utilizing more, and again can cause damage to the car if you do not allow for going over those at a reduced rate. Another tip, 3-second following distance in Kentucky, that's a minimum. They recommend 3 to 4 seconds. Something else that's changed. I learned a car length for every 10 miles per hour. 3 seconds, what that means is the car in front of you getting your following distance, what you think is accurate, is they go by, say, a sign, then count your 3 seconds. 1, 1,000, 2, 1,000, 3, 1,000. You should approach that sign at that 3 seconds and then adjust it. If you get there too quickly, you know, give yourself a little more room. Some different driving strategies as we go through this. You know, you're getting behind the car, the wheel of a car. Is your mind full, or are you going to be mindful? Awareness is so important. We just do so many things automatically, and you don't realize the power that a vehicle has and the danger that you can present to others and to yourself when you get on the road. Be aware of what's going on around you. Things you can talk to someone about if you're concerned on their driving. Give them some self-limiting strategies. You know, avoid driving at night, busy times, bad weather, fewer trips, shorter distances, all ideas to bring forth. Typical problem situation, left turns, especially where there's not a signal, yielding the right of way, merging, another huge area. You know, people on New Circle Road here in Lexington, they get up, they're getting ready to merge, traffic's busy, and all of a sudden they just stop right as they're getting on there. And then the next thing you know, they floor it and they're going 80 miles an hour trying to merge into traffic. That is not the proper way to do it. They should probably use back streets in that situation. When you talk about left turn strategies, probably several of you are like, really, I'm not going to turn right, and turn right again. You know, when you get in the car, your mind is, I'm trying to get from point A to point B. I'm not interested in trying to slow down that driving to get to that destination. but you have to think about the risk involved in that. The other thing about that, you really, it is not a situation that costs you time and money generally. UPS does that. They have their fleet of vehicles do that. 10 million gallons of fuel saved a year, 6 to 8 fewer miles driven per route, and emissions control into the atmosphere were also affected. So again, turn right, turn right, turn right again, if that's a possibility and there's not a signal light. Right away, another area I want to mention, if there's not a light working, treat it as a 4-way stop. Kind of a tip with that. Aggressive drivers, oh my goodness, just ignore them. It's scary out there. You don't know who's got a gun, what anger is going on. So, you know, as an older person, you usually do get people honking the horn, making those gestures. So as you're talking to someone in your family, just reemphasize this, ignore them. If someone feels they're in danger, get to a safe place. And if you've got somebody riding with you, you know, reinforce that as you're going down the street and you pass a fire station that's close to them, then say to them, oh, I forget about this fire station here all the time. You know, that's a safe place. If you're ever out on the road, you could always pull in here. If you feel unsafe, don't forget that this is here. They're here 24 hours, 7 days a week. Driving in the rain, another hazard. Hydroplaning, see that. If you've ever done that, if you've lost that traction, that connection to the road, even if it's for a second or two, it kind of makes your stomach flip-flop. School bus tips. I put this in here because we're now excited that a lot of kids are going back to school, or maybe you're not. I don't know. That's kind of another discussion, I guess. But school buses are out on the roads now. Stop for school buses. It is against the law if they've got their sign out. Now, an exception to that, again, if it's a 4-lane road, here in Lexington, Versailles Road comes to mind going on into town, 2 lanes going into town, 2 lanes coming out of town. If that bus is on the opposite side of the highway and stops, you do not need to stop. If you're going into town, 2 lanes going in, the bus is going out of town and stops. I see that as I go to work and go down that road. I will see that school bus stop and all of a sudden traffic is moving at a steady pace and someone puts on their brakes and you're like, what happened? And it is, they've recognized the bus across several lanes of traffic. Percent of teens, 40%, say they've been hit or nearly hit by a car, bike, or motorcycle while walking. FedEx survey. So again, if you're behind the wheel of the car, you are not only responsible for what you're doing, but you have to take on the responsibility of all the people out there that are either walking, bicyclists, you know, they become your responsibility as well. As far as bicyclists, we're seeing more and more of that. We're seeing more lane changes and roadway changes. Do not tap your horn. A lot of us like to be considerate and let somebody on a bicycle know we're going to go around them and tap their horn. Do not do that. Allow 3 feet. New law that got recently passed in Kentucky as you pass someone. That's from like the mirrors on your car to the furthest point, which is usually the handlebars on a bicycle. Allow 3 feet when you pass them. If you are involved in an accident and there's an injury or damage exceeding $500, you have to notify the police. And if they can't come, if it's busy for whatever reason, and they tell you it's going to be 2 hours, just take the information. That has to happen within 10 days. There's a certain amount of information you need to get. A lot of insurance company can give you a little crash reporting kit, and you can just stick that in your glove box. It makes someone who is a senior, been driving a long time, has a wonderful record of minimal amount of accidents, and they're involved in a little fender bender, get extremely anxious that this has happened, and they want to spend more time saying, I haven't had a problem in forever. And so kind of talk through with someone that you're close to if that's a concern. It's like, You got your insurance card? Is that in the glove box? You know, if you have an accident, you just pull that out. Tell them what's kind of involved in that situation. Smart 911, want to mention that. That's something you can go online and register for. You can tie it to your phone. You can also put information in it about your home. So it can include, in my niece's situation, she's got a big old dog that's 150 pounds. It's a Cane Corsa. And she looks like the meanest thing ever. And she's just about docile. She can hardly walk and you can't get her to move off the bed. But she's included in our Smart 911. You know, I have a huge dog that looks very ferocious, but she responds to Eva and she's not threatening. But so the first responders kind of know what to expect. You can again include medical information. I suffer from seizures. I'm a diabetic. I'm on blood thinners, whatever information. So if you're involved in a motor vehicle crash and you're on blood thinners, even though there might not be visible bleeding, you're more at risk for maybe some internal bleeding. First responders, they call that first hour, the golden hour. And if they've got that information, they're able to react much quicker. This yellow dot program, it's good in over 40 states now, I think. And it's a little folder of information you fill out. There's a little sticker you put on your windshield and you put this folder with that personal information and those medical conditions, put it in your glove box. So if you're in an accident and you can't speak, first responder sees that little sticker, looks in your glove box and gets that information. So one of the last sections that I want to talk about are some different driving concerns and the risk that are involved with them. Give you the contact information to obtain We Need to Talk brochures, and then just talk about some of the alternatives to driving yourself. There's certainly a lot of warning signs for unsafe driving, whether it's physical, whether it's cognitive decrease of abilities, just your skills. And there's actual evidence, you know, that warning signs, if you're not able to see or hear, and we talked about that, you know, that puts you at risk. If you're slow, being able to move your foot from the gas to the brake. You can't turn all the way around and look really good when you're merging, when you're backing up. All of those put you a little more at risk. Again, from a cognitive decrease, you may be less confident, getting lost in familiar places. Now, I'm not talking about if you've been to the grocery and you come out and it's like, where is my car? I thought I parked it. And you're kind of looking down the aisles. I have a silver 4-door car, and so does everyone else in the parking lot as I'm trying to look for my car. That's not the lost I'm talking about. It's like when you look up and it's like, where was I going? What am I doing? That's the lost in familiar places. For driving skills, again, be aware if you're riding with someone, be observant of what's going on. Hitting curbs, you know, if somebody's honking at you all the time. If you've got scrapes, dents on your car, on your mailbox, where you've cut too close trying to get the mail out of it. You've got a lot of close calls. If you've been stopped by the police and it's like, I noticed you were kind of swerving a little bit, or you weren't obeying the speed, either going too fast or often too slow. If you've actually been involved in a crash, all those are kind of evidence of warning signs. So how do you start that conversation? Oh my goodness, it's difficult. You know, there's so much emotion related to driving. It represents independence, freedoms with it. You can actually get in the car, go where you want to go, when you want to do it. So talking about giving up the keys is a very sensitive subject, and you have to approach that respectfully. You know, how important is driving to that person you're going to have that conversation with? And you want to start it before it's a real problem. You know, don't think that you're having one conversation and it's going to be successful, because it is a series of conversations that you and others will need to have. I mean, count yourself very lucky if it's a one-time, or someone approaches you proactively and says, honey, I'm worried about my driving. Will you take my keys? It just doesn't happen. This is the We Need to Talk brochure. It's actually a free publication. You can order it online. They'll send it to you in the mail. You can actually download it. It is, it's a great tool. There are classes sponsored by AARP that are also called We Need to Talk, but it gives you kind of scripting, some things that you can use. And I've actually pulled out the booklet, examples of that. Did you hear about the car accident in the news today? Because about every day, if you turn on the news, you're going to hear of some accident. And so that's kind of sometimes a good icebreaker to start that conversation. That way it's not about the person you're talking to, it's about something else that happened. I'm glad you've cut down on night driving. I'd never want you to feel that it's too risky to drive. Again, recognizing chances that they've made, if they've made changes, give them credit for it. Say, you know, you could save hundreds of dollars if you sold your car. And then you have to kind of go on into that and talk to them and sell that idea. I know you'd feel terrible if someone else was hurt when you were driving. Again, those are just some scripted responses that are available in that booklet to kind of give you some talking tools to use as you start those series of conversations. You want to be respectful. You want to be supportive of changes. You want to know of options for delivery. And we've certainly learned a lot during this pandemic on how to get medications, how to get food, how to get supplies. So share that information. Know about alternative transportation. And then it may actually progress to like a formal driving assessment. You've got to be very respectful. You know, we're here in March, big talk, one and done. Well, it is not one and done in these driving conversations. Again, it's a series. And sometimes that's best. Maybe you do the first one. Maybe another conversation is by somebody differently, and it's a planned series. Maybe it's somebody that they're close to. It could even be someone like clergy member or a physician. If there's somebody that has given up driving that is close to them, that's another person that's kind of great to involved in that. It's better to mention physical limitations than cognitive decline. Seems like a person's more accepting of that. This is another poor slide. You can't read this very well, but it's a self-assessment. It's one that I use in one of the AARP classes that I teach. And I encourage people that are 55 and older to do this routinely a couple times a year, go down through there. There's points associated with it. And it's kind of eye-opening. It's things like, feel cars suddenly appeared from nowhere. Well, yeah, sometimes I do. Lack confidence sometimes. Well, yeah. Nervous, agitated, irritated while driving. Sometimes. Had some close calls. I mean, so again, I consider myself a great driver. But as you go down through there, I can pick several of those and kind of come up with it sometimes. And so those scores are associated with a point total. And for that particular assessment, then there's scoring guidelines associated with it. There are other tools very similar that are located online and in other driving classes. That doesn't work. Consider a formal driving assessment. And that's usually done by a professional, most of the time an occupational therapist. They kind of go through what corrections can happen. They may actually offer some assistive equipment, help outfit your car, whether it's a pedal extender or a spinner knob so that you can grab that to help turn the wheel. I mean, there are different things that they can do. That's what they do. The thing about that, it is a fee for service and it is not covered by insurance. But again, think about it, it could save somebody's life. The full cost of that is around $1,000. Cardinal Hill here in Lexington does that at discounted 50%. It's $495, and that's been the price now for several years. There's a process to actually get signed up for that. You need an order from a physician. You need to have a driver's license. So if someone's license is expired, they haven't been driving for a while, there are things like one-day license that you can get. But I do have information on that. If you've got specific questions, I can send you out a packet that kind of tells you more about that. If all those things don't work, what do you do? Well, there is a reporting process. Other people can report drivers, kind of goes through circuit clerks, sheriffs, judges, county commonwealth attorney, physicians, but you too can do that. It takes 2 citizens and it has to be a notarized, it's an affidavit to the medical review board. And then you have to be very specific in examples. The review board then takes that information, reviews that, and can make a determination. The thing about that, you are not submitting that anonymously. So don't think that's an easy out. And it's like, oh, I'm just going to file this and I'll get my daughter here to sign this and we'll send this in. It is part of the process. And the transportation cabinet actually can release this document to the driver or whoever's asking on behalf of the driver. So it is not a confidential document. Utilize alternative travel options. Again, knowing what's out there is important. Family, friends, paratransit services. It's Bluegrass Ultra Transit in some of our surrounding counties. It's Wheels operated by Red Cross here. There are things like ITN of the Bluegrass that are here in Lexington and expanding their services. That's kind of an arm through arm, they call it, door-to-door service for seniors, people 60 and up, or if they're visually impaired. And it's billed monthly. That way a senior doesn't have to get their check the first of the month and say, oh, I need to keep this money out because I'm going to have to go get my hair fixed third Wednesday of the month. They do have a scholarship program that is addressing the cost of rides, and they are supporting that if for low income folks as well. When I talked about using the scripting, you can save hundreds of dollars. People are like, well, no, not if I have to pay just to go down here to get my hair cut. But actually, if they line item that out, it is very expensive to own and operate a vehicle. You look at the insurance, you look at the taxes, you look at the upkeep on the vehicle. Estimates are somewhere around $8,500 a year to maintain, own, and operate a vehicle. And that's a vehicle that's 4 to 7 years old. Vehicle 10 years old, it's probably around $6,000. Last estimate I looked at. Certainly depreciation, you take that into factor, but the cost, expenses and repairs are often higher. So in summary, the big thing, never too early to plan for a time unable to drive safely. You start that conversation before the driving needs to stop. Start using some of the strategies that I talked about today so that people will be safer while they're on the road. And when and how to approach that giving up the keys, it's very complex. Remember, it's a series of conversations, and there's a lot of tools out there to kind of help you through that journey. Develop a plan, but make sure that it's really flexible as you move through. So that kind of concludes. Again, I appreciate your interest in this topic. It is very complex. It's very emotional for you as one that may have to have that conversation, or if you're the person that's seriously thinking it's time to give up driving. So thank you again so much.